Okay, so here we go. Someone coughed and the entire world got locked up. Someone coughed in Wuhan, China, and we got to meet and know very intimately, for some people, this small submicroscopic agent virus that's called the SARS-CoV-2 virus and causes the disease in humans known as COVID-19. And it hasn't only caused that, it has caused also the appearance of a black market for hand sanitizers. Keep your distance. 6 feet is a minimum, and a lot of people are asking, well, why 6 feet? To which I respond, well, why don't you move to Antarctica? Then you'll be a little bit further away. Well, 6 feet is just a rule of thumb. It's a minimum, it's a guideline, it's not absolute. It just means you need to keep some distance away from someone who might be infectious, contaminated. Another thing that's very important is to wear a mask when you're outside of your home, because you don't know who you will meet that can infect you, that can be contagious. It's better to be safe than sorry. And I wanted to show you a photo of my son, well, because he's my son and I like him a lot, but also because he's a maxillofacial prosthodontist, and in his own words, he says, in my office, when I'm doing surgery, spit, saliva, and blood fly all over the place. Therefore, he has to dress, not in scrubs, but he has to dress up like this. He looks like something out of Star Wars, right? With face shield, he's double masked. These are the loops that he uses because he's literally in the patient's face and inside his mouth working. Double gloved, protective outer clothing, protective shoe covers, and so on. So this is what our surgeons are up to nowadays, and they have to do this. And he has had to partition his office so that this is the waiting room that you're seeing here. And this partition was constructed by Tony, my son, who's a Rotarian in our club, and Miguel. So both of them, they put up this partition so that the patients can be screened out here. And eventually, when the kits become available, they'll be tested before they go into the office space. And you don't want them to contaminate the inner office space. Wearing a face mask is better than wearing a ventilator. I think we'll all agree on that. Staying in your home is better than staying in the ICU. And certainly praying is better than complaining right now. Stay home, stay safe. Today we're mostly going to talk about herd immunity. It's a phrase that we have all gotten to know more and more as the days go by. It's become very popular. I'd like to talk about what it is and why it's important. So this is us. Each one of these white squares represents one person. So let's say that this is our herd. This is our group of people around us, friends, colleagues, or people at work. And no one, as of a few months ago, had COVID-19. No one had a vaccine for it. And we were all vulnerable, no previous exposure. Now, the extreme opposite of this is when we have been exposed or had the vaccine, and everyone, the entire herd, is immune because each one of these had the disease and became immune, or had a vaccine, which we don't yet have, but eventually will, and is also immune. So how do you get from this to that? Since here you're not safe, but here everyone is safe. Well, this is how it starts. The vulnerable herd meets one person who is infected, who is contagious. And this disease has high infectivity. It is more contagious than any of the other coronaviruses, including the SARS-CoV-1 influenza. So it spreads very quickly. One person contaminates 3 around, and those 3 contaminate another 3, and pretty soon a lot of people, almost the entire herd, is contaminated and infectious and contagious and has the disease. And then this happens. The entire herd is affected. But each one of these starts to respond with the immune system, fight the disease, and eventually they get over the illness and they are immune. They're immune to further infection. And that also extends to others as they overcome the disease, and more become immune, to the point where they outnumber those that are still fighting the disease. But eventually, there's at least one person who is neither immune nor affected by the disease. So that person is very susceptible to these others that are close by and can get infected very easily. So what do you do with that person? Quarantine. That person has to be in quarantine. And that person has to be in quarantine until the overwhelming majority of those around him, at home, in the neighborhood, in the workplace, are immune, and there's a lot of distance from anyone who might be infected. Then you can stop that quarantine. And eventually, everyone will be immune or immunized, has had the vaccine, but there will be a person or two that for some reason did not get the disease, therefore is not immune, and perhaps cannot take the vaccine because they are allergic to vaccines or whatever reasons, right? But they're safe because everyone around them is immune, and no one can get close to them in their circle of friends and co-workers because they protect this one person who's vulnerable. So that is herd immunity. Now let's talk about California a little bit, because there's something that I find very, very interesting going on in California. Talk about California first a little bit. It's first in the US in terms of population. We have close to 40 million people in California. We're number 1. As to area, we're number 3 after Alaska and Texas. We have 163,000 square miles of territory. California is a very large state. Coastline, 3,400 miles. Economy, we're 5th, not in the States, we're 5th in the world. In the world, we have a larger economy, a more successful economy than most countries in Europe, in the world. But on the other hand, and you have to see both sides of the coin, we're also number 1 as to homeless people. We're first in the US with 180,000 homeless, which accounts for 50% of the homeless people in the US. And that is a very sad story, terrible, something we need to do something about. Now, and very pertinent to the situation we're in, as to tourism, we're number 1. We get more or less 270 million tourists every year in California. And about 7% are from outside the US, so about 9 million are from outside the US. Many of them are from China. Now let's talk about air travel. We have over 235 million arrivals every year at our airports in California. And 18% of those are international, so about 4 million. And about half of those come from China. Why? Because if you're flying from China to the US, California is the most likely first stop that you will make, also because it's tourist attractions and the Chinese like California. So we have a lot of Chinese coming to visit California or to study in California or to be with friends, family in California. There are direct flights, not now, but there are usually direct flights to and from Wuhan, China, to San Francisco, Los Angeles, San Diego, and other airports in California. These are the direct flights. So during the past 6 months, a year, when all of this crisis that we have has been developing, and just prior to its start, just prior to its onset, we have had a continued flow of Chinese visitors, tourists, students, etc. Many of them coming directly from Wuhan. So let's change focus for a minute. Let's look at what's happening in California with COVID-19. We are having much less than the expected problem with COVID-19. Why has that happened? Why, when we have so many homeless? Why, when we are not towards the top in terms of the number of nurses, physicians, hospital beds that we have, we're not number one in the US. So you would think that we are susceptible to the worst that this pandemic could bring to us, and yet the numbers show the opposite. So in trying to explain that, I looked at what happened towards the end of the year in California. And this is what happened. Each one of these curves represents the incidence of influenza-like illness. Influenza-like, remember, we didn't have COVID. So everything that was like influenza was called influenza-like, year by year by year, okay? 16, 17, 18, 19, and in purple, 2020. The highest incidence of influenza-like illness occurred towards the end of 2019 and beginning of 2020. Look at that peak. Over 90,000 influenza-like illness cases occurred during that period of time, higher than any previous year. And it's called influenza-like because many of these patients with that syndrome were tested by CDC, and it was found that they were not positive. They were negative for influenza A. So the conclusion was, well, they must have influenza B or some other type of influenza, because we didn't know about COVID-19 at that time. In retrospect, those patients must have had COVID-19. Then the COVID-19 illness became known, right here in this dotted red line. And from then on, we called it COVID-19 disease. Okay? And that's why this line has a sudden and abrupt stop, because from then on, we called it COVID-19. I believe that this was COVID-19 for the most part all along. Some parts of it were influenza A, okay? But that huge jump from year to year, so that 2019-20 was the highest incidence, must have represented COVID-19. Now you have to ask yourself, what happened with those patients? Well, unfortunately, some of them died, and the death certificates will read, cause of death, influenza. It will not read COVID-19, or it will say cause of death, complications, diabetes, of heart disease, or some other concomitant illness. So when we go to collect the data on COVID-19, none of this is going to appear as COVID-19 because it had not been recognized until here. However, these people, the majority of them did recover from what they thought was the flu or a bad cold, an unusually bad cold, and went on to develop immunity to COVID-19, because that's what they had. They actually had COVID-19. So when we think we're starting to see cases of COVID-19 towards February, early March, we saw fewer than expected. And as time goes by, we have seen fewer than we expected in any case. Why? Because a lot of our herd was already immune to COVID-19. They could not be infected, and they protected others around it from getting infected. And because that, in terms of infection, in terms of the incidence, in terms of the number of cases in California, if we compare ourselves to every other state of the union, we are 32nd in terms of infected cases. And that is clearly much less than we expected. In terms of hospitalizations, again, fewer than expected. And importantly, in terms of deaths, many people are recovering, few people are dying from this disease because fewer are infected, therefore fewer deaths. We're number 27 as compared to every other state in terms of deaths so far. And we certainly hope that it stays that way. Again, because some percent of Californians are already immune. The herd was partially immune when this pandemic hit us in late February, early March or so of this year. So this is the importance of herd immunity and how it has served to protect us. Now, how are we going to be able to prove that this is correct? Well, at some point, hopefully soon, instead of the nasal swabs that are currently used to show whether or not you have COVID-19, and what that test shows is that you have particles of the virus in your system. Instead of that, we will be doing finger sticks. Prick your finger, take a drop of blood, put it on a plastic, small plastic platter, and test it for antibodies. And that will show that you have immunity. You have antibodies, you have immunity to COVID-19. And we will show that not only in persons who have had the disease, recovered, and are immune, but that's where we are going to find out how much of our population, without having the disease recently, is immune. Why? Because they had it back in November and December of 2019, and it passed as influenza-like illness, ILI. It was really COVID-19. I think that has worked in our favor immensely, and if that turns out to be proven, which I think it will, thank God that it was that way. So be informed, not scared, follow recommendations, apply your common sense, be prudent, stay healthy, and be 100% convinced that we are making it out of this, that we are well on our way to developing the vaccines that we need and that will be so helpful, that we're well on our way to developing treatments that may be curative, hopefully, but at least palliative for this disease that's now affecting us. We're gonna make it out of this. We will survive. This too will pass. Thank you.